We're back with Dr. Neil Floch and with his patient, Sally Gunzy.
Sally, welcome to Health Talk.
Welcome.
Glad to have you here.
Glad to be here.
Now, Sally, my understanding is you had gastric bypass surgery and then regained all of the weight. Tell us your story. Going way back to the beginning.
Yeah, 11 years ago, I had the gastric bypass. Well, the first year, I did pretty well. I lost 120 pounds.
Sounds good to me.
Then what happened was I started gaining it back slowly, and I went back to the doctor, but there was no follow-through with that.
Now, Sally, when you had lost all this weight and then it started to creep back up, maybe I can ask Neil, is some weight gain typical after an initial loss? And at what point do you start to get worried that it's too much?
You know, typically patients will lose most of their weight in the 6 months, but they'll continue to lose weight after gastric bypass over 1 3/4 years. So if they're not losing a lot, or they're losing the weight and slowly regaining it back sooner than that, you need to look into it, make sure there's not a problem with that the patient's having either emotionally or whether it's a physical problem wrong with a bypass.
So how about you? You started to gain it back. And
started gaining it back slowly, and then I think it was 2008, I had problems with my stomach, and I had an endoscopy done. But the doctor said to me that you didn't have a gastric bypass. My stomach was just normal.
And how much weight had you gained back by then?
All of it,
so
plus more.
So you had your surgery 2002, you said?
Actually 1999. And then, yes, and then in 2009, I found out that the gastric bypass wasn't working. It took that long for me to figure it out and doctors to figure it out.
You must have been very disappointed or upset to have gone through surgery with all of these expectations and be right back where you were despite that?
Right. I was a failure. I failed again at a diet. And there was this tool that was there to help me, and it was gone, so to speak. So then my sister, just recently, about a year ago, went to Dr. Floch, Fairfield Bariatrics, and she told him my story because she was having the lap band. He said, I think I might be able to help your sister, because she told him that I gained all my weight back, and it was just like he was there, you know, and then he wanted to see me, and with that I made an appointment, and he says, yes, I can help you. And he explained to me what happened, because I had no clue about what had happened, and you explained it to me, which I still don't understand it, but if you want to explain it.
Neil, maybe you can explain it. What happened?
Actually, you know, it's funny, very funny, this story, and I thought it was such a unique story because it was Sally's sister who was describing to me Sally, and she said she had the surgery, and you know, she was all upset because it didn't work out. She followed all the directions and everything, and she was doing and trying her best, but it wasn't working. So when she described it, I go, wow, that sounds like the stomach reconnected. And although you hear about that, you know, and it's unusual, even when surgeons, and I know that Sally went to an excellent surgeon when she had her surgery the first time, so it's nothing wrong with the technique that's performed, but sometimes the devices, the way they're done, sometimes the stomach can reconnect. Mm-hmm. So when you put a scope in and you see the stomach's reconnected, what you need to do is then separate the two parts of the stomach, like we said, and we did in the surgery. Right. And sometimes we did, I explained this many times to you.
Yes, I know.
But sometimes we have to go over it again. So simply what we do, we go in laparoscopically with the small incisions, and using a stapler device, we're able to separate that part of the stomach that's actually grown back together again. And although it's a very rare situation, it can be easily fixed.
So the key to you as a diagnostician was the fact that she'd regained, or I should say the keys, was the fact that she had regained the weight, and that at that endoscopy, the gastroenterologist did not think she had had a gastric bypass.
Right. And then I knew, you know, just hearing the story from her sister, I knew exactly what happened. I said, bring her in. I think I can really help her.
And did you think he was clairvoyant?
No. But my experience with working with his group, it's been amazing. They go through the emotional, the physical. You have to exercise. You have to the nutritionist, everything. I mean, it's one big group of people that are really there, and they're very supportive. They're there from the beginning until, well, it's the rest of your life that you have to deal with this. So,
how did it feel finding out that there was something you could do?
it was like my second chance. And I wasn't going to blow it this time. I didn't blow it the first time, but I felt like I did. And this is it just gave me so much hope that it was there again, and that I didn't do something wrong, and that
Did you feel vindicated? Did you feel somehow maybe you hadn't really failed, but
yes,
I mean the stomach reattached itself. You couldn't help that.
I know, but that happens, and. It's just amazing.
And we do have a picture of you before your second operation, so let's bring that up and see if it looks anything like you now. This doesn't look very much like you.
No, that was my long time ago.
So that was before the second operation?
Yes,
then.
yes.
And how long ago was your second operation?
Actually, today is my anniversary. It's been a year.
Oh, congratulations!
Happy birthday!
Thanks. And I'm still losing, and it's still coming off. I started going to the support groups, which are very, very helpful, and because there's other people, in my situation, and it's just very important to follow up and do, the exercise. It's very important too.
How much have you lost since the second operation?
123, I think it's been.
Congratulations.
Yeah. Thank you very much.
And what did you actually see when you went in laparoscopically?
Well, what you see is
what does it look like when his stomach reattaches itself?
Well, you know what? You have to be extra. We're very careful. We're extra meticulous when you're going in on reoperative surgery. And we use techniques where we can look inside the stomach itself at the same time with an endoscope. And we carefully take things down. And what we saw is where the stomach was stapled, the staplers that they had before were actually not as advanced as we have now. And the stomach had regrown through the staples. So we just saw that one area was reconnected.
Wow.
So it was still partially divided, but enough was connected that the food was taking its normal track.
Correct, yeah.
So she was absorbing everything.
Well, the food was going
More
two
than she
ways. It was going through the new channel that was created and through the old channel. So it was essentially like she didn't have a gastric bypass.
And Sally, what was it like after the second surgery? Did you have cramps or nausea?
No. Well, I have a very high tolerance for pain, so it wasn't painful at all. They gave me pain medication, but I didn't take it because it was laparoscopic, and there were like 5 incisions, that very small ones, and I felt great. I got up and walked like the first night that I had the surgery, and I more physical than I ever have been in my life. Now, the recovery was about a month. I stayed out of work, and I really probably could have gone back in 3 weeks. It really wasn't that bad.
Sally, we have about a minute left, and we know, and you mentioned this too, Neil, before, that being significantly overweight is a lifelong challenge. Mm-hmm. Maybe do you have any words of encouragement for some of our viewers out there who may be struggling still?
Well, there's hope. I mean, I thought I had failed, and sure enough, I saw Dr. Floch, and like I said, it gave me a second chance, and I can't thank him enough, and well, my sister too, because she went in there and had the lap band, and I was very, very hopeful, and I'm very happy that I went through it the second time, because it really, I feel like a totally different person. And anybody out there who's even thinking about it, I would suggest do it. I mean, it's just worth it.
Well, yours is such a hopeful story. We really appreciate your being on the show.
Well, thank you. Thank you.
Thank you very much.